Hi, my name is Leah Spurrier. I am a student here at Regis College with Dr. Pepeska in Advanced Pathophysiology. This is my flashcard on von Willebrand disease. Disease process. Von Willebrand disease is an inherited or acquired disorder of 3 types. Each type presents differently: type 1, type 2, and type 3. Types 1 and 2 are autosomal dominant, and type 3 is autosomal recessive. Those with this disease lack or are deficient in the von Willebrand factor. Von Willebrand factor is an essential glycoprotein in cells, vital in platelet adhesion, activation, and aggregation. To understand the process of von Willebrand disease, it is essential to comprehend clot formation and the role that the von Willebrand factor plays in blood clotting. 2 cells are involved in blood clotting: platelets circulating in the body and endothelial cells within the vasculature. When an injury occurs, platelets attempt to adhere to the site of injury. Von Willebrand factor is a protein that plays a role in adhesion. Endothelial cells change from preventing clots to promoting blood clots when vessels are injured. Von Willebrand factor are multimetric and can vary in size. The larger the size, the better the binding properties and their ability to bind to platelets inside the vasculature to help in clotting formation. Each type of von Willebrand disease manifests differently. Type 1 is a milder and only has partial loss of the von Willebrand factor. Type 2 has 4 subtypes, 2A being the most common, and this type has more significant loss of the factor, and the larger multimeters are lost, which, as mentioned, are big helpers in clotting. Type 3 is the most severe, and no von Willebrand factor is present, creating an increased risk of bleeding and more difficulty treating. Risk factors for von Willebrand disease. Von Willebrand disease is often caused by a genetic component. However, loss of the von Willebrand factor can be acquired. The risk factors for the inherited form is a family member who has the disease. Genetics play into risk factors for developing von Willebrand disease, as certain genes can be mutated, increasing the risk of development. Studies have shown that Caucasians have a high risk for this disease. For those who acquire von Willebrand disease, the risk factors are often associated with an underlying condition: many cancers, other clotting disorders, and autoimmune diseases. Major signs and symptoms. Von Willebrand is a common condition, and symptoms are based on the type of von Willebrand factor. Type 1 and type 2 can be minor to moderate, easy bruising, and occasional nosebleeds. However, the disease may go undiagnosed because the individual only has minor loss of the von Willebrand factor. Type 3 symptoms are more severe, even with minor injuries, due to no factor being present. Women can experience heavy and excessive menstrual bleeding, as well as postpartum hemorrhage. For women who have menstrual bleeding with several passing clots lasting more than 8 days, consistently saturating sanitary protection hourly for several days, women who suffer postpartum hemorrhage often have a blood loss of greater than 1,000 mL. Additionally, many surgeries and some injuries in those with type 3 may cause severe bleeding, where individuals need blood products or hospital stay to control the bleeding. In this disease process, the complete blood count is expected to be normal unless the individual presents with a severe case. Further testing is needed for diagnosis. It is important to test for factor VIII function, which is to stabilize and mediate adhesion to platelets. Coagulation tests are also needed. APTT, APPT, INR, fibrinogen, D-dimer, platelets, and thrombin time are essential tests to run to form a proper diagnosis. The von Willebrand factor activity test is also important to diagnose because levels below 30 indicate the disease. Due to this being most often an inherited trait, it is essential to do genetic testing. This is a list of my references, and thank you for watching my flashcard presentation.